When someone is suffering with a true addiction, oftentimes we think it's that person and it's that person's problem. But really, addiction is a whole family situation. And Dr. Nick joins us this morning with that. Good to see you.
Good to see you too, Whitney, and thanks for talking about this subject.
Yes.
We're not talking to addicts today. We're talking to families of addicts.
And what can we do to help?
Brothers and sisters and parents.
Yeah, and love family. I mean friends who are like family, even coworkers sometimes.
It's really, I think, important for people to understand that it is a family problem, or that families are affected and maybe even inflicted by that behavior.
It's a family situation.
It's a family situation. But what we need to be clear about is that families it's sometimes one or the other. It's just his problem. He's got to work on it. I'm going to send him to therapy with Dr. Nick, which makes me want to pull my hair out.
Really?
Yes, because I want to know the system. I want to know how the family's treating this behavior, how they may be enabling it. Or shaming the addict, which does no good. So, but anyway, they can go one or the other, which is it's his or her problem, or they can say, "What did I do?
Well, I would think
how did I cause it? What can I do to save or to change or to help?" And really, neither are truly the path. The path is in the middle. In the middle, in the sense, yes, it's his or her disease, behavior, a pattern, compulsive activity, but the family can either reinforce it or change their behaviors, which in turn will impact and influence the addict. For instance, you don't give a glass of wine to a recovering alcoholic and say it's okay. You don't give money to somebody that doesn't have a job and hasn't worked in 6 months and says, "Well, I'm just getting off of opiates and I can't do anything." Do you hear how at what point do the parents have to say, enough?
You have to do the other things in your life to rebuild.
You have to. And what really makes it complicated is that the family has to say, this is what it is doing to affect me. I'm not judging you. I'm telling you what it's doing to affect me.
Is that powerful for the addict?
It's very powerful. And what happens to my children when you're over there drunk? And how they read that. You're not aware of your behaviors and what it does to our relationship when you do it. But the other thing that needs to be also kind of reinforced is this notion of empowerment, meaning that there are consequences to your behavior.
Right. And
you'll lose I'm providing you with a cell phone right now during your recovery, but you keep having relapses. Not going to work.
Right.
You're going to lose it.
Right. I'm letting you live here now, but
I'm letting you
if
live
you're
here.
Just going back to drugs every time, this obviously is really not a solution that's working.
Right. Here's a list of things that have been done through therapy to help you do it. You're supposed to be going to AA or NA. If you choose that you don't want to do it, you're obviously telling me that you don't want help, and I'm going to not help.
And for families, sometimes that is impossible.
Whitney, please know that I'm not saying this without an immense amount of compassion. Right. But at what point do we say it's not working? This system is not working. I think you've been really in some ways privileged with a really fairly healthy family, but there are many out there that just want to pull their hair out because they don't want to say you've got to go, or we're going to put you in a halfway house.
Well, I had a family member who had a surgery on a leg and got addicted to stupid OxyContin.
Pain pills, which is so easy.
But can I tell you that my mother finally, after like the third
relapsed? Oh, rehab. Wow.
She was like, I am done. And something else happened. They say everybody's bottom's different, and that person hit bottom and did it
got through.
Solo.
Got through.
Then my mother and other people and family members gathered around and lifted up, but she was done.
It's not rejection. It's I'm done enabling it. Because what we end up doing as a family is we're enabling the self-destruction. We're enabling the slow suicide. Yeah. You see, and as hard as it is, it's just, to me, there's a compelling force that says the family is important. you know, and it's also important to the recovery in the sense of, again, good boundaries. I just felt like families needed to hear there is a way.
And
there is a way.
Right, and to tackle it as a unit if you can with a professional. Don't let someone go solo.
I would certainly think tackle it. I tell you, Whitney, I really have gotten to where I will say when someone wants to come in, I want to meet the family. I want to know the dynamic, because so many things will come out. Mm-hmm. So many things will come out. There can be a parent that has no idea that he's shaming his daughter. But every time she goes on an alcohol, it's you're worthless. You're never going to amount to anything. Do you hear? All it does is make her. And I'm not taking away her responsibility. I'm saying that he doesn't realize what he's doing.
Sure.
He's contributing.
Right.
You're thinking. It's real, isn't it?
No, yeah.
I bet it concerns you. You have children.
Right.
You don't know what's out there.
Right.
And they could have surgery and get on opiates, and then all of a sudden become.
Yeah.
There was a show on CNN on
world.
prescription.
Oh, I wanted to see that.
Yeah, on CNN they did it a couple of weeks ago or last week. I'm not sure.
I think it's a
when.
national epidemic. I think.
Yeah.
I don't know what the solution is.
And then
but I
maybe
think
families
it's real.
have to look at themselves. I don't know what mom and daddy's doing. Maybe they're on prescription drugs. Maybe they have to look at some of their own behaviors.
Sure. Or some of the pains from the past on each side, you know, that sometimes contribute to that.
And just to quickly close on a positive note,
Yes.
the great thing about making the changes is that we're giving everyone a choice.
Mm-hmm.
You can find another way of handling your stress, or you can move out.
Let me ask you one last question, and this is, you know, in your professional role, if the addict won't get help, is it still beneficial for other family members to go and seek counseling?
Absolutely.
Okay.
Thank you. Because again, if I can help them make changes, that's going to influence. In fact, the addict is not going to like me very much.
And that's okay.
That's okay. And it's also okay for the addict to get angry at parents. That's okay. All I said was, you keep doing it, you're going to lose your cell phone. You don't need to get mad at me. You just need to abide by the rules of the house.
Right. Because life is full of
Yeah.
consequences.
So yes, definitely they can get help.
Okay.
And really need to.
Yeah.
Yeah.
Great. Thanks so much, Dr. Nick. Good to
Thank
see
you, Whitney. I was thinking, I'm sorry.
Much more Weekends with Whitney coming up right after this.